Hi everyone, it's Dr. Ansari. I am going to be talking about painful bladder syndrome, which is also known as interstitial cystitis. So the short forms of these long terms are PBS, and then interstitial cystitis is just known sometimes as IC. So I'm going to be using IC as the term during this talk as I'm writing. So basically, painful bladder syndrome is a unique condition of inflammation without an infection. And that's really important to remember because sometimes we get a lot of delay in diagnosis because patients with IC or PBS, they get treated repeatedly for infections because that's what people think it is. It looks like it sounds like it, and so they keep getting antibiotics thrown at them. But if one does a urine culture, which is to send the urine to a lab where they look at it under a microscope, not under a microscope, once they grow it into a petri dish, they will grow out either bacteria or no bacteria. And in interstitial cystitis, there's no bacteria because there is no infection causing the issue. What's happening is that there is an event. It could be a urinary tract infection. It could be maybe, drinking too much alcohol or eating something new. It could be a life event like the loss of a loved one. Anything that provokes what's next is an inflammatory response. Okay, so then you get an inflammatory response. So if it was an infection, maybe you had an infection, it got treated with an antibiotic, but the inflammation never went away. Or if you had a big life event, like a death of a loved one, it triggered a stress response, which triggered inflammation, most likely whole body inflammation. But maybe it lingered more in the bladder. So whatever that event is that triggered the inflammatory event, next what happens is that it causes the typical signs and symptoms of interstitial cystitis, which are confused with a urinary tract infection. So pain in the bladder or pain with urination that is often relieved after you finish peeing. That's typical, but not always. Urgency to urinate and frequency to urinate. You go to the bathroom all the time, like every hour, every 30 minutes. So that's what's happening once the inflammation kicks in. Then all of this information also involves the brain. And we're not exactly sure how the brain is involved because this condition, IC, is still rather a mystery to us. But we do realize that certain nerves and certain chemicals get triggered in the brain that just further enhances aspects of this cycle. One of the things that gets involved as well or triggered is stress and anxiety over what's being felt. Okay, so the stress and anxiety are major contributors to further inflammation. So now you can see we literally start going in a circle around and around because we're not able to break the cycle. That's interstitial cystitis, causing pain, bladder pain, urinary urgency, urinary frequency in the self-perpetuating cycle that isn't breaking. In the next video, we're going to talk about the different treatments we can utilize to try to break the cycle in various areas or various points. Okay?